I'm sitting here today with Kevin Jackson, the Black Sphere, theblacksphere.net, right?
That's correct.
And Kevin, you actually just had a book coming out, which I'd like to talk to you about. But first, we're here just outside of the Russ Carnahan Healthcare Forum, and I'm wondering if I get your thoughts on the forum.
Well, so far, uneventful. Carnahan's in there praising the Missouri system of colleges and a host of other things, and wanting to express his idea that we should all, talk about this cordially, etc. And it's a basic question for me, and of course they're not going to let anybody ask questions. They're screening cards in there so they can field the right questions. But essentially, my gut feel is that he's not going to let any conservatives really ask questions. And the problem that I have is that the basic question is, why aren't you guys wanting to be on the same program as you want the citizens to be on? It's so good, why doesn't Congress have to be on it?
I'm going to take, first of all, any other panelists want to comment on that? Okay.
And there's a lot of folks in there who are, quadriplegics, paraplegics, etc. You can tell they've got lots of disabilities in there, and I guarantee you they're in there wondering, what is this system going to mean for me? I have an answer for those people. You're going to be off of it. If you look at the way this administration works, they've got Holdren, who's a eugenicist. They've got Hillary Clinton, who got the Margaret Sanger Award. They've got Barack Obama, who's praised Planned Parenthood, and Margaret Sanger as well. You've got Pelosi.
Maybe you could just give us a little background on who Margaret Sanger is.
Margaret Sanger is a eugenicist who believed in the destruction of the mongrel races, mainly black people, and she wanted to keep enough of us around to serve the needs of the elite. And she's also didn't want, anybody that effectively was not able to produce, sort of a Marxist mentality. Anybody that's not able to produce should be gone. So if you look at some of the components of this healthcare system, the very, very elderly, you're off the system. If you're catastrophic with cancer, they're going to give you. It's going to be like Saving Private Ryan, where they shoot you with morphine and say he's too far gone. That's what we're looking at here. Not to mention a debt that we're going to pass on to our kids and our grandkids that is absolutely. It's atrocious. The amount of money it's going to take to survive in America for our children and our grandchildren is essentially unattainable. America, as we know it, will change dramatically. And quite frankly, if they implement this, it won't be long before we don't even exist as a country.
Do you have an estimate for what the dollar tag on this is going to be?
Their estimates are $1.6 billion, but when you think about what the government estimate, ask any city what they estimated to build a bridge or to build a road, and they told you it was going to be $20 million, and then $60 million later, it's built. So whatever number they give you, put a multiplier on it. If it was a Republican administration, you'd probably put a 2x multiplier. Since it's a Democratic administration, put a 5x multiplier on it. That's what you're going to get. And at the end of the day, watch a video by Steven Crowder, a buddy of mine, where he goes and tests out in real life the Canadian healthcare system and see how their system works so well. The system that everybody wants to laud is the one we should go to. Go to England and talk to these people and find out how long it takes just to get a simple blood test, and then tell me that you want socialized health care here in America.
One of the questions that I've raised, and not, I don't think it'll get asked here at the forum, is should the bill have an amendment that guarantees some sort of service level? You get care within, say, a month or something like that. Do you see something like that getting bolted onto this?
It won't matter. Whatever they pass and whatever rules that apply to it will not matter. They will ultimately change the rules. They'll amend it. If it's a month, they'll amend it to 3 months. If that doesn't work, they'll amend it to 6 months. It's kind of like Social Security. They'll amend the age that it takes for you to collect it in order to make the system survive. So the system, once they implement a system like this, it's done. It has nothing to do with the amendments that get put in. What they should be looking at is the fraud and the waste that's in it. Medicare and Medicaid right now are already broken, and they're in triage. You want to talk about health care? Those guys are in triage. They're leaking money.
Would you advocate fixing those before doing anything?
Absolutely. Those are government-run systems that are so broken that they're practically bankrupt. So here you've got a bankrupt system in existence already, and you want to do another system to bankrupt. It makes no fundamental sense. And anybody with half a brain knows that. That's the problem with liberals and Democrats, is they don't have half a brains. They think emotionally about these issues. And the sad part is that the people that it's supposed to help, the people that really need it, many of the people in those rooms being pushed around in wheelchairs by other folks, those are the people on the system that it's going to crush the most.